My name is Aarthi Shenoy. I am a physician in hematology oncology. I did my medical training at the University of Iowa, my residency at the University of California in San Diego, and then my fellowship at the National Institutes of Health. Hematology oncology, I think, is broader than what we often think of as just the oncology realm, which is, breast cancer, colon cancer, things like that. It incorporates also hematology, which is the blood cancers, as well as just things that we don't think of for patients coming to hematology oncology, which is people that have bleeding problems and clotting problems and just problems with their bone marrow working. Not typically thought of cancers, but something that's also covered by hematology oncology. I am a hematologist mostly, so I see patients with hematologic problems. So that means patients that have blood cancers, lymphoma, which is a cancer of the immune system, myeloma, the same thing, as well as bleeding problems and clotting problems. So I don't treat what I think people typically think of as oncology patients. When I was at the NIH, I did a lot of clinical trials in myelodysplastic syndrome. Definitely here, we take care of a lot of patients with myelodysplastic syndrome, and we're trying to open more trials here. We do take a part in a lot of hematologic trials, specifically in myeloma, leukemia, lymphoma. And also, we're hoping to open a new skin lymphoma center here, which we've just started in the last 6 months. I think in a lot of places, hematology and oncology are kind of lumped together, and definitely there's a role for a primary hematologist. The diseases in hematology are so vast between lymphoma, myeloma, bleeding, and clotting that I think it's very hard for an oncologist to do that and the other things he needs to know about the other cancers. So there's definitely a role for a hematologist, and that's something we have here at Hospital Center in our Hematology Oncology department. We have 3 of us that just do hematology, and that means that we focus just on those diseases and can stay more updated on the current science behind treatment of those patients.